So these three structures make up the porta hepatis. So IVC, in patient in left lateral decubitus posture, you can see the degree of intrahepatic bile duct ataxia, and they are extending up to the periphery of the liver, going up to the periphery of the liver, quite obvious. And the CBD can be traced up to the head of the pancreas. This is the head of the pancreas. This is the longitudinal section. This is the head of the pancreas. And this is the superior mesenteric vein, this is the CBD, and this is the calculus within the CBD. This is common bile duct. And this is the liver. So this is the pancreatic head, and you know that the common bile duct crosses the posterior inferior surface of the pancreatic head. So you can see the common bile duct at the posterior inferior surface of the head of the pancreas in longitudinal section. Now the gallbladder in transverse section. This is the body of the pancreas, this is the tail of the pancreas, and this is the left kidney in transverse section. Again, this is the liver, this is the pancreas, body of the pancreas, tail of the pancreas, splenic vein, superior mesenteric vein, superior mesenteric artery, aorta, and these are the duodenal gases. And we don't see any focal lesion relating to the pancreas. However, now this is the dilated common bile duct. Here it is dilated up to 18 millimeters, and it has a calculus here at its most distal end, where it courses the posterior inferior surface of the head of the pancreas. This is the head of the pancreas. So this is the head of the pancreas. This is the common bile duct. And this is the calculus. These are duodenal gases. This is the calculus with sharp posterior shadow. Note the sharpness of the shadow. This is the head of the pancreas, this is body of the pancreas, this is the, and if you concentrate on this tiny vessel, this is the splenic vein, this is the superior mesenteric artery with echogenic borders, this is the left renal vein entering the IVC, this is the aorta. So there is not any pathology seen relating to the pancreas in transverse section even. However, dilated common bile duct with a calculus within it is seen coursing the posterior inferior surface of the pancreatic head. This is the pancreatic head. Is there any para-aortic plan, porta-hepatic plan lymph node enlargement? No, there is no porta-hepatic plan lymph node enlargement. This is the portal vein. This is the portal vein. No para-aortic plan lymph nodes. So this is a case of choledocholithiasis with obstructive jaundice. I've tried to explain you the pathologies, the normal as well. This is the gallbladder, clear of any calcifications or debris or focal lesion. This is the wall of the GB, which is 1.8 millimeter, and these all serpentinous shaped structures you are seeing are the dilated common bile ducts. Bird's eye view of the spleen. Spleen is normal. It measures 10.8 centimeters. Normal is up to 12 centimeters. The view of the pelvis. There is a site. If there is an independent region ascites, no ascites is seen. This is the uterus in a longitudinal section with anteriorly placed urinary bladder. This is the urinary bladder, and this is the uterus in longitudinal section. What about the kidney? This is the right kidney, and it is normal in longitudinal section. So our study completes with the impression of a case of obstructive jaundice due to a calculus impacted into the distal end of the dilated CBD at the region of at the posterior inferior surface of the head of the pancreas. Here we are. This is the dilated CBD that you are seeing. Once again, this is the CBD, common bile duct. This is the calculus with posterior shadowing, sharp posterior shadowing, and this is the head of the pancreas, and the common bile duct you can see is coursing the posterior inferior surface of the pancreatic head. This is the liver, and these are the dilated intrahepatic bile ducts. These are the dilated intrahepatic bile ducts. Okay.